What's up, guys? Welcome back to the nursing channel. This is Nurse Sam, and I'm going to talk to you guys right now about jobs that you can work from home as a nurse. And so there are 3 jobs that come to my mind when I think about remote jobs for nursing. All right. And these 3 jobs that I'm going to mention are pay very well, and the nice thing is you're working from home, so you don't have a supervisor, you don't have a manager looking over your shoulder telling you what to do, telling you what you aren't doing. So it's nice. Also, a benefit of working from home is you don't have those nasty coworkers that always like to gossip, or they distract you from your work, or just give you those mean looks. You know what I mean? Like, you don't need that bad energy. Keep that away from you. At home, you're chilling. You got your laptop. You can be on your bed. You can be laying on your couch. As long as you're doing the work, there's no issue with that. You can be playing the music that you like to hear. You can watch your kids as you're working. I mean, there's so many benefits of working from home. But anyways, I'm going to talk to you about 3 nursing jobs that you can do straight from your home, okay? All right, the first one is telephonic nursing, okay? So basically, what does that entail? That means you will be getting calls basically what that entails is you're going to be on the phone for most of your shift, okay? You're going to be getting calls from patients. And what you're going to be doing is you're going to be triaging these patients, okay? So you're going to get a patient calling you, hey, I have a runny nose, I have a cough that started a day ago, and they're going to be telling you that, they have a lot of chest congestion. And so as a telephonic nurse, it's your job to triage them appropriately and tell them whether they need to go to the urgent care, or if it's something that's very severe, you're gonna refer them to the emergency department. And you can also, if you're not sure, you can refer them to the doctor via a FaceTime call. You can make an appointment with the doctor, and then they'll make the determination from there. The virtual doctor can also prescribe meds over the phone. As a telephonic nurse, you're also going to be scheduling appointments for patients with their primary care doctor. All right, and so that's it for telephonic nursing. All right, the next type of nurse that can work from home is nurse case manager. An outpatient nurse case manager. And primarily what you're going to be doing in this capacity is you're going to be scheduling a lot of follow-up appointments for patients that have discharged from the hospital. You're going to be ensuring that they picked up their discharge medications and they're being compliant with their medications. So you're just going to be doing a simple follow-up call and be like, hey, so-and-so, how are you doing? How are you feeling? Have you been compliant have you been taking all your medication? Do you know when your next appointment is to see your primary care doctor? So these are the types of phone calls you're going to be making. In addition to that, you're also going to be helping patients that need hemodialysis. You're going to be arranging their appointments as well and informing them of when their next visit is. Okay. Another thing is, if there's anything that you need to communicate with that patient's primary care doctor, for instance, maybe they need to prolong their home health care, you're just going to follow up with your patient's primary care doctor. Just give him a quick phone call and letting him know that the patient's going to need a longer duration for his home health, and that the patient is short on this medication so that the doctor can prescribe more, whether it's insulin, whether it's his pain medication. Okay, so This is what you're going to be doing as an outpatient nurse case manager. All right, the last position I want to mention that you can work from home as a nurse is utilization review nurse. So as a utilization review nurse, you're going to be giving a list of patients, and you're going to be on your laptop, okay, like the one I have here, and you're just going to be going through and these patients that you've been given are patients that are in a hospital, and you're going to be reviewing the charts to determine whether these patients need to remain in the hospital, okay? And if they don't, then you'll have to notify the insurance that the patient is medically stable, and you'll be doing all of that through a program called Interqual. Okay, I can't get into detail, but I do have videos where I go into specifics regarding utilization review. Okay, but essentially what you're going to be doing as a utilization review nurse is you're just going to be going through patient charts, looking at the type of treatment they're getting, looking at whether they're medically stable or they're not, and they still need more treatment, whether it's treatment for congestive heart failure, whether it's treatment for pneumonia, whether they still need more IV antibiotics in the hospital. You're going to be looking at the chart, and you're going to be notifying the patient's insurance that, hey, this is the type of treatment we're giving the patient, so we'll need to get reimbursed for the medical care that we provided on these days for this patient. And it's a lot simple. This job is very simple. It's not a complicated job. It might sound complicated the way I'm describing it, but it's very simple in the sense that there's a special program called Interqual, like I mentioned before, where you're just clicking boxes to see if the patient is meeting criteria to remain in the hospital. Okay. Well, that's it. That's all I have for you guys today. Let me know if you guys got any comments, any questions, and don't forget to like and subscribe to this channel. Don't forget to hit the thumbs up on this video. I'm out. I love you guys. Peace.